There are a lot of reasons why people try to pursue spine surgery, but in general, I find that it's most effective if it's done for a very focal reason, and the goals are clear. The biggest focal reason why people need spine surgery, in my opinion, is to decompress a nerve. Stenosis is one of the more common terms that people hear when they think about spine surgery, and that's an overgrowth of arthritic tissue, ligaments, and sometimes bone that pinches off a nerve. It could be from a herniated disc as well. In these cases, by removing that tissue and that pressure on the nerve, we take away a lot of that pain, and thus we have a successful procedure. In some cases, to do that, we remove too much bone that the spine is no longer stable at that segment. And so to fix that, we use screws and rods to hold that segment together, and that's the reason why we would do a fusion. And fusions come in many different forms, some with extra implants or cages to open the space by themselves, others just to maintain additional levels of stability. You may see longer constructs, smaller constructs. It's very, very different, and it's very, very personalized. Another big reason why people have indications for spine surgery is because of a malalignment to the spine. The most important responsibility our spine has is to keep our head directly over our hips. The entire curvature of the way our spine works is entirely to do that. And so if we find that there is a structural reason why your spine is no longer able to accomplish that, and we are not able to compensate for it without significant pain, then we can do a reconstructive procedure to realign that spine. And that can be because of scoliosis, it can be because of prior surgery, it can be because of trauma, or it can be because of poor bone like osteoporosis that consistently results in us leaning forward where we really should be standing up straight. And so for those combination, that really encompasses the majority of the reasons why we do spine surgery.